All right. Well, good evening, everyone. My name is Ted O'Connell. I'm the program director at Kaiser Permanente, Napa-Solano. We're very happy to have all of you joining us this evening for a discussion on wellness in residency. This session is being hosted by Dr. Kathy Holder and Dr. Tessa Stecker. And we also have a number of residents who are going to be joining to help discuss how they think about and approach wellness in residency. Dr. Vanessa Franco is on already, and hopefully another couple residents will be joining us as we go. So thank you for the investment in time and your interest in our residency program to all the applicants who've joined us this evening. We certainly appreciate that. And with that, I will turn this over to Drs. Stecker and Holder.
Hi, everyone. It's great to be here, and thank you so much. I love all the waves. So if you have a chance, you can go to our residency website, because we actually did a prior discussion with two of our former graduates on wellness. And during that time, we actually kind of focused on the transition from medical school to residency, and we talked about imposter syndrome. And we can talk about that again tonight, or if other topics come up. We really want this to kind of be interactive. But I encourage you, if you have time, to go to our website and check that out. I actually would love to really incorporate our residents' attitudes and perceptions and thoughts on wellness and residency resiliency into the conversation. So thank you, Vanessa, for joining us. So shall we open it up? Tessa, did you want to show just the first slide? Yeah, we can go. And really, I'd love to open it up to the group, or maybe we can put Vanessa on the spot and ask you to help define what is wellness to you, because it's a very personal, a personal thing. So maybe, Vanessa, if you want to open us up, you can talk about what wellness is.
So wellness, especially when it's related to residency, for me is to having the ability to maintain not only my physical health, but my mental health and my relationships, on top of, all the things that I have to do for work, so that I can be the best resident that I can be. Because even though you're really dedicated, you're spending a lot of time at work and worrying about your patients, you also have to take care of yourself to be able to care for other people. So that's my best way to define the wellness.
Did anyone from the audience want to chime in on how you define wellness for yourself, or
yeah, I can do
what you're looking for? That'd be great.
And you could use the chat functionality as well.
Oh, can you hear me?
We can hear you, Elizabeth. Yes.
Okay. I think what you said, you touched on not just the patients. I think if you can sum it up in one word, for me, it's the balance between family life and making sure I have an emotional, mental, and spiritual well-being overall, and physical. I'm all looking at your pictures. I think, I'm like you're displaying basically a lot of the core things that come into wellness. However, the way residency is set up, it's not supposed to cater to wellness. So then that's why we're, I guess, having this discussion and kind of seeing how you guys have integrated that into the curriculum. So balance is my take home. Thanks.
Good.
Thank you.
Anyone else want to chime in or put in a question into the chat?
Can I actually pull Matt Simkowick, our associate program director, just joined, and I think he has a really nice perspective on wellness, and I would love to have him kind of share his thoughts with the group, because I think it helps frame some of this discussion.
And just real quick, Matthew Maeda has posted something for us on our chat box here says 8 dimensions of wellness: emotional, environmental, financial, intellectual, occupational, physical, spiritual, and social. Thanks, Matthew.
Thanks, Matthew. Thanks, Ted. Aspirational. Can you guys hear me okay?
Yes.
Okay, great. Yeah, so I think aspirational. This is, so when we, actually first, thank you, Elizabeth, for your comments. I think, you know, really insightful. And I think that that is the history of, you know, wellness with regard to not only graduate medical education, but I think in many respects to undergraduate medical education, that there was a lot of, you know, sort of suffering, I think, that residents went through during the process of training. And, you know, when Ted and I and you know, a couple of the faculty, you know, first started having, you know, our conversations about building the curriculum, we actually, you know, started talking about that piece of it from the very beginning. Lots of people in medical education and in medicine in general were talking about it. And I don't think anybody really knew exactly, you know, they didn't have it even broken down to Matt's, you know, wonderful 8 kind of aspects of wellness. And, you know, and we decided to just kind of ask those questions together as we built the program, right? We thought about it when we thought about, you know, how long the shifts were going to be, of course, and that was kind of the low-hanging fruit. But we actually tried to think about wellness when we thought about everything that we do in the residency program. And we still do. We still, you know, every quarter, a number of faculty, it's about 50-50 faculty and residents get together in our program evaluation committee, and we go through different curriculum, you know, together, and we, you know, kind of take a look at the strengths and the weaknesses and whether or not we want to change anything to the curriculum or build a new curriculum. And each time we ask about the wellness, you know, sort of the wellness meter of that particular curriculum, and how everything that we're doing affects it. And the types of things that have come up over the years. So I'm not an expert. I haven't broken it down into 10 things, but the things that do come up are whether or not a resident has responsibility, whether or not the resident can take ownership over the work that they're doing, whether or not they're needed and valued to, you know, to provide care for patients. That tends to be really important to people, right? And I think probably a lot of us listening will identify. Certainly I can identify going back to medical school, really wanted to take care of patients. I was capable of it and I wanted to do it. That being said, kind of the other end of that spectrum, really important that people have adequate supervision, right? When a learner is taking care of a patient and they don't know what they're doing or they're not comfortable what they're doing, comfortable in what they're doing, that tends not to be a very, and just tends to be a very stressful experience. The thing that comes up a lot is, you know, in our discussions is kind of efficiency, for lack of a better word. How efficient is that experience? If I'm there for 8 hours, am I learning a lot? Am I working hard? Am I taking care of patients? Do I have good supervision? Or is there a lot of downtime? Is there a lot of time where I'm not sure what I'm supposed to be doing? That correlates very highly. And then I think I'm going to just wrap it up and let other people share. But the other piece, we kind of, I don't know what to call it exactly, but maybe sort of the teamedness of the experience, right? Who are the other members of the team and how do they relate to each other? Do they care for each other? Are they willing to back up each other when, you know, when anyone is stressed or needs help? Are people willing to ask for help? And I think with the teamedness, I certainly, you know, will say that I really like to have fun, and I really I would sort of say the laughter factor. I really like to laugh with my teams. I do on you know, in clinic, inpatient team. We do a lot of serious work taking care of patients. We have serious conversations, but we also do a lot of laughing. And I think that that's a common experience, you know, across all. I observe it all the time. Occasionally I see Dr. Stecker and Dr. Holder laughing when they're accepting, you know, people sometimes catch Ted and I laughing when we're precepting. Vanessa sometimes laugh. I'm like, so I think I'm going to leave it there and let other people share.
I would actually love to add a couple of my own thoughts to this, Matt, and I think you've heard me say some of this before. There's other pieces as well. One of them is, are you actually passionate about what you're doing? Because you can work hard, and if you're passionate about it and pursuing your passions, those hours go by very quickly, and you can even feel fresh at the end of a longish day. And in addition to getting really outstanding training in full spectrum family medicine, are there outlets for you to pursue your passions? And that's something that we did very intentionally. So whether it's community medicine or global health or integrative medicine or sports medicine, or you name it, we really want to have outlets for almost all of those. And not just outlets, but have those really be built into the residency program so that you're fueling your passions and all of those things that you did during medical school that you were so excited about. Do you have the ability to keep doing those while you're training to be a family physician? With regard to the teamedness, I also think about it in terms of, a supportive environment. And that's a somewhat vague term, but what happens when you have a family emergency or you suddenly need to go attend to some urgent matter in your personal life? Like, what does the team around you, how do they react to that? And what do they do to support you? And because that can be a real driver of wellness or not wellness if those support structures aren't in place. And then even thinking about patient care, Matt, you talked about it from the resident perspective of having the ability to be supervised and spread your wings more and more over time. But even from both a resident and an attending perspective, can you pick up the phone and discuss a case with a specialist? And oftentimes the patient doesn't need a consult. It's the physician needs an answer from a specialist. And can you get that in an efficient manner and move on with your patient care and get the patients the great care that they need? Mm-hmm. And if the patient does need a consult or a procedure or a study, can you get that in an efficient manner so that it happens within the day if it's necessary, or within a day or two, so that you're not worrying about the care that your patients need, and you don't go home with this, continued mental energy about the care, the care that your patients may not be getting, or having to figure out how to get the patients that care. And so I think, wellness can be defined by a lot of wellness initiatives that I think is on one of these slides. And it's all this other stuff that happen, or that either happens or doesn't happen. And so I just wanted to, Matt had some really great thoughts and wanted to share some of my own as well.
I stopped sharing for a second because I think it's easier for people to share their thoughts if you can see more people than trying to scroll through a little thing on the side. But really would love to just open it up. And I think that Vanessa and Ted and Matt did a really nice job of thinking about it from the perspective of our residency program and really focusing on the system. Because I think so many times when we're thinking about wellness, it's how does the system support wellness, as opposed to why it doesn't need to be an individual always being the one, trying to fight for their own wellness. So I know that we have a couple of other comments in the chat that I did want to read out for the group. And maybe some of these are questions as well that we can answer, but also feel free to unmute yourselves and just join the conversation. And we only have 2 slides left of our very short presentation, which are just highlighting some of the areas that we're doing within the residency programs. We can finish up with that later. So Marianne asks, what kind of mental and emotional support services are available to residents? For instance, when dealing with a difficult case or a death of a patient. Oh, that's great. Vanessa, do you want to talk a little bit about Ballant and some of those things that are built into the residency program? And we can.
Yeah, I was trying to answer that. So one of the things that are built in is every quarter we have a meeting, ideally with all the residents from first year, second year, third year. Sometimes one of us cannot make it, but with our behavior medicine specialists, they're part of our team, but they want to just check with all of us, see how we're doing, if there's anything that's being hard or anything that we would like to share as a group. And at that time too, if you feel that you need more, like a one-on-one attention or talk to one of them, you can always ask. And it's, it's a good opportunity to check in with the others, to check in with our behavior medicine team. And in case, of course, if you need, you can always consult with them, like as professional service, like you have access to the psychiatrist and then to the therapist. Above and beyond that, like there's things like the gym. And I really think that, at least for me, a big part of the wellness program is that every year there's so much work done into building the teams, helping the residents integrate with each other, know each other, that you get to really know your coworkers, and then we have, like, I think, meaningful relationships in our teams, and then having those relationships really help too. But you always also have faculty, you have your own advisor, you can always talk to them too, if you're struggling with anything.
Vanessa, did you want to mention as well Schwartz rounds and talk a little bit about that, since you've helped lead one of those sessions, and Balin group and those types of activities that happen as well? The
Schwartz rounds, it's for the hospital as a whole, for all of us, and I don't know how frequently they meet. I think it's like twice a year, or they have like a large conference, usually at lunchtime, where they bring up themes like, death of a patient or responding to codes, things that, like the last one, the one that I helped, that I participated and helped like lead, was about, COVID and the stress of COVID within the medical community. And they usually invite couple of us, residents or nurses or doctors, to talk about their experience with that particular issue. And then it opens to discussion, and people can talk about their feelings. They can talk about, how they dealt with all of that. And I think it's just like a beautiful initiative. And, we hold those at Kaiser as well.
Vanessa, can I just add that the Schwartz rounds are typically held probably at least once every quarter, and they're multidisciplinary. So they're attended by, as Vanessa mentioned, nurses, medical assistants, physicians, pharmacists. It's a wonderful opportunity for multidisciplinary teams to really get together and be vulnerable with one another and share how a difficult outcome or an unexpected outcome might have affected them. And it allows for healing and sharing, and it can be very powerful. And that's actually hospital-wide.
Very, very well, very well put, Dr. Holder. Thank you.
I see a question in here from Harini, if you don't mind posing this one. I think it may be somewhat similar to what we've already talked about. And Harini, I know you emailed me separately, and I don't recall if this was the question or not. I can look at my email. But if you don't mind posing whichever question you'd like to have answered.
Yeah, well, I think they did a pretty good job of answering this first one, so I'll go ahead and ask my other question. But I just wanted to ask, during times of personal crisis or illness, how have people in this program been understanding or accommodating?
That's a great question, and that's really, really important. And I think that even part of the first question that was asked, the area that we didn't really address was the fact that any one of us at any time could have our own behavioral health challenges that we are working through. And it's really important to have a situation, an environment, a culture in which that is supported and which you have all of the resources and supports in place as well. And so we are really fortunate to have excellent coverage for not only medical and dental benefits, but behavioral health as well, confidential, 100% covered for our resident physicians and fellows in terms of therapy appointments. All of those things are really incorporated in there. So I did want to point out that fact, because I think that is really important to consider. And then Vanessa, do you want to address a little bit from the residents' perspective, maybe Harini's question in terms of the residency culture, in terms of allowing for that time, that space, that support in those extenuating circumstances or situations?
So I'm just trying to think of examples, but this is like, I can't think of anybody like that having sick or ill or had a family emergency recently, but we had residents that had babies during the residency and they had to be away for a while. And we work very closely with the faculty and the rest of the team to rearrange our schedule so the person can have that time off that is needed. And then like we have access to all the mental health benefits that Kaiser have to offer as well. And I'm just trying to see what else I could add to that.
I can actually give a few examples that might trigger your brain, or I don't know if you were even aware. But, I mean, we had one, and I want to be cognizant of people's privacy, but we had one resident a couple of years ago whose brother committed suicide, and we needed a sudden change in schedules and support for her. Last year, a resident whose one of the in-laws was dying on the East Coast, and there was a need for the family to be involved there. In the middle of the pandemic, we had at least one, if not more, residents who were living with older family members or parents and had to really be thinking about accommodations related to that, especially when, early when we really didn't know how the virus was spreading very well, and there was a lot of uncertainty around that. So we could talk about kind of any of those and how we addressed them. I would like to add too, besides all of the resources that have been mentioned, residents also, besides getting mental health services through Kaiser Permanente, also have an external benefit. So you can get it from non-Kaiser Permanente providers. So in case you want or need an added layer of privacy.
And, this is like one real crisis that I remember being part of. When I was on the beginning of my second year, the class that had just graduated above us, we lost a resident. Somebody that had just graduated that week had an accident and passed away. And I remember how, of course, it was hard on everybody, not only the resident team, but the MAs that worked with them, with the nurses. And I really liked the way it was handled. The clinics were canceled that afternoon, and Ted and Matt got us all together for like a meeting where we could discuss that, and and everybody was able to talk, like, of course, receive the news, but everybody was able to talk about and talk about their feelings, and then all the steps that we had after that was very important to me as well. There was one moment that is registering for me as like one big moment of crisis for all of us. And, I really like the way that the residency program dealt with that.
Oh, I just wanted to ask about that. I mean, I think that's something that's big, debriefing and kind of talking about what goes down. I just 2 days ago, I heard one of my classmates also committed suicide, and mental health and wellness is always great. And I think that since we don't talk about it, the worst thing that I've seen, because this is not the first case, and I've been interested in this pattern overall and just how medicine plays like an occupational hazard into mental health. But my point being that most of the time it's not talked about. Like you said, you got to stop clinic. That's what you feel like, stopping for a second and just kind of, I can go to a therapy session and tell the therapist about it, but they don't know this person or didn't, you need kind of like a debrief session. So how is it, so you guys are able, it sounds like you guys are able to shut down and do that. I guess what kind of infrastructure do you guys have that you guys can do that? That's kind of nice to know.
Well, I'll answer that one because that was my decision. We're part of a larger department and part of a medical center as a whole. And I think this is a group practice. And I think the group that, whether it's wildfires or the stresses of COVID or, everything that's happened, like you name it, there's been item after item this year that have put stress on groups of people and individuals. And I think our medical group has done a really, really good job of trying to support all of us. And the decision was, we need to notify everybody what happened. We need to debrief and be able to talk about it and let people grieve. And there's no way, and we have to tell everybody, in a pretty synchronous fashion so that, everybody's finding out at the same time. And once people find out, you are not going to be able to run your afternoon clinic. And so we just immediately shut it down for the afternoon, made that executive decision and called our medical director and let him know. And he said, 100%, you absolutely have my support to do that.
That's amazing.
It's just the way our organization functions.
Yeah. That's great. Thank you.
Hey, Ted, can I, let me just add to Elizabeth, that there was another question in the chat about when patients have bad outcomes and what do we do? And directly related, we work in a medical center that, as Dr. Holder said, cares about our emotional well-being in the process of doing very hard work. And it's certainly a deeply important thing to the residents and the faculty in this program. But I think that we are fortunate that we share this, kind of common philosophy with most of the other people in the medical center, certainly our leadership, but our other departments. Our residents are fortunate that kind of the main places in which that happens are, the inpatient wards, right, where our patients are very sick. And then occasionally and very, dramatically and incredibly difficult, so occasionally on labor and delivery, where we have bad outcomes. And I certainly will speak from, personal experience on the wards. We have the ability to, if needed, bring in other people to finish the work and round on the patients and give people the time to debrief. Our women's health department, covering labor and delivery, absolutely the same way. And these things, unfortunately, they're rare, but they do happen. And when they happen and people need to debrief, that we have a lot of very close friends and colleagues in women's health that will come over and take labor and delivery so that the team that had the event can do what they need to do to to debrief and to begin their process of healing, because it happens. We have all had patients die on us. We've all been involved in in really challenging things in medicine. It's a part of the job, and we have to support each other, right? That's also we believe that's as important a part of the job.
I think
so hopefully that's helpful.
I'd like to
are particularly tuned into kind of supporting one another, perhaps more than some specialties. So that I think helps. I wanted to loop back around about these cases with, that affected residents, because I kind of put them out there and then we didn't talk about what we actually did. And I don't want it to seem like not a closed loop. So, you know, the resident who was living with an older parent during the time of COVID, we flexed her right into virtual care, and that went on for weeks until like she kind of sorted out her living situation and got more comfortable with what was going on, and then ultimately made the decision to come back to an inpatient rotation. And then she lived basically in the garage of her home, or a separate downstairs area, and isolated herself from her children and her husband and this older parent. But she was first on our list to be all virtual until that situation could really be clarified. Resident who had an in-law on the East Coast who was passing away, she was kind of asking us about what we thought she should do. And we said, you need to go like this and be there for your husband and go be with your mother-in-law. You'll never regret going, and you will absolutely regret not going, and close down whatever her, I don't even remember what her clinical duties were. And, you know, we have backup systems in place to take care of that. And there was no question that she would just go. And she was very, I think, thankful on the tail end that we kind of pushed her a little bit to do that, because sometimes you feel a need to have permission to do some of these things. With the resident who lost her brother, immediately just all of her clinical duties were shut down. Backup systems were put in place. We got her clinic seen that day. And and then we made sure she had the emotional support from us and the mental health support that she needed, and was able to go be with her family. But I mean, if that's just the way you do things, then it doesn't even become a question, and you can just kind of, the system goes right into place, and then our jobs become to support that individual who's having a hard time.
And I just want to jump in about what Ted was, Matt was talking about with difficult situations with patients. Thank God I didn't have too many, but we occasionally will lose a patient on HBS, or we're going to have that conversation with the family about placing somebody in palliative care, or, you know, giving a hard, you know, diagnosis to a patient. In my experience, I never felt just thrown into the situation. We always had discussions prior to, like, if you're going to give a diagnosis, or if you're going to talk to a family about options for like palliative care, or, you know, we always discuss it prior. I always had my attendings being very mindful, giving me all the support that I needed to start those conversations. And after the fact, you always come back, you always debrief, you always talk, how was it, how did you feel, you know. For me, it has always been smooth on that sense. And then Matt brought the subject of the labor and delivery. I've been present for one very, I would say, tragic. It was a fetal demise, but it was the patient's first baby, and she was 38 weeks along. And that was like, is still like in my brain that day. But I remember that like after talking to the patient, and I remember I couldn't hold back the tears, and then I was talking to my attending. That night was one of our OBGYNs, and I was telling her, like, I don't know if I can continue the care for this patient, and she was very understanding, very caring, you know. And then I didn't need to follow that particular patient through with some more of the care, because I didn't feel that I had the emotional strength to do it at that time. And they were very understanding, very supportive. And we also sat down and talked and had a debriefing about the whole situation, because that was like a really, really hard one that happened. Yeah.
Thank you for sharing that, Vanessa. There's actually been a couple of other good questions that have come in that I think probably most of them would be great to have you answer from a resident perspective, Vanessa. Brittany, do you mind posing your question?
Yes, sure. I was just wondering, let me remember exactly what it was. How do you guys handle residents needing to make their own doctor's appointments or therapy appointments? And is that feasible, especially on like inpatient where a weekly therapy appointment might be challenging.
So I can tell, like, maybe it's oversharing, but I'm on therapy, but I was able to arrange times on, eventually on weekends and on times that that I have availability. Even when you're in the inpatient wards, on Thursdays, at least for our first years, you have didactics time. So the afternoon is blocked for you and for the didactics, and you're going to be done at 5:30. So on that Thursday is a time that you can, like, if you need something more frequent like therapy appointments. As far as medical appointments, dentist appointments, I think that it goes like with any other employment, right? You try, if it's something that you're going to book ahead of time, you can always try to do it when you're on a lighter rotation, but if it's something that's necessary and you're in a inpatient rotation, a labor and delivery, we always arrange amongst us coverage. So you can be out that day, you just need to let us know. Or, of course, last minute, like, oh my gosh, I woke up and I'm really sick. We have a structure in place. We always have somebody on every year training, first year, second and third year, who's going to be the backup for the other residents. So if you call in sick that morning, then the chief resident or Elizabeth or one of the preceptors will call you and say, hey, so-and-so called in sick. Can you please, be covering today? Or, you will be needed to cover tomorrow. We have that in place for emergencies and sick calls and things like that.
Thank you.
Thanks, Vanessa. There's a nice question here from Nadim that would also be a good one for residents, and Billy has joined, so you're not alone anymore, Vanessa. Nadim, do you mind asking your question?
Yeah, sure. I just had a quick question for the residents. What was your challenge in transitioning from medical school to residency, and how were you able to maintain your wellness while overcoming these challenges during residency?
Billy, would you like to start with that one?
I think, Billy, you're muted.
Sorry, yeah, I'm just trying to figure out my audio. Can everybody hear me?
Yes.
We can hear you now.
Hello, sorry for joining late. I am just getting out and heading home. By choice, I will add, from my awesome gyne clinic month that I'm on, just doing a lot of prenatal and procedure things. So, sorry, the question was about the challenge from transitioning from medical school to residency.
Yes.
And how you're able to maintain wellness while overcoming those challenges.
Gotcha. Yeah. I think my biggest challenge from medical school to residency was just the amount of free time that I had, honestly, in terms of wellness. I went from in medical school feeling like I had hours and hours every day that I could kind of choose what to do with, to not having that anymore. And I think some of the best advice I got as I was coming into residency was to pick like one or two things that you really wanted to continue doing and just kind of dive all into those in your free time, rather than trying to spread out all of your wellness amongst many things that you were doing. And that's worked really well for me. And for me, that's like spending time with my partner and staying active in one way or another. And that's worked really well for me. And I think in our residency, we're really lucky to have faculty in a program that has built time off and wellness into our schedules in a way that makes it really doable to feel like you have a lot of time outside of work to work on yourself. Sorry you can't see me because I am now driving.
You don't need to see him, not kidding.
You don't want to see me in a dark box.
Keep your eyes on the road, Billy. That's part of wellness.
That's right.
Vanessa, did you want to talk at all about the transition?
Yes, it was really tricky for me. I felt like it hit me out of nowhere. I felt like, oh no, I'm prepared. I can do this. And then my biggest issue was my anxiety, really. And what Dr. Holder touched briefly, the imposter syndrome, right? It was really heavy on me, more than I really expected. And I still remember the feeling, like sometimes on the rotations when a nurse would come in and say, hey, doctor, I would be like, me? I wanted to like hide under the table. So I was one of the residents that took advantage of our balance and then talked to one of our BMS specialists, and he arranged for me to have some sessions, like some private sessions, and that's when I started my therapy as well, and that has helped me a lot. And then other than that, I think, like Billy said, like I have a great relationship with my partner. Like I don't know how he bared with me for my first year residency. And then making sure that, I also took some time off to do things that where I'm not like thinking about medicine, I'm not thinking about my patients. So whenever I had that golden weekend or that day off, I continue to read the books that I love, or watching the series that I love, and then going for hikes and walks. That all helped a lot too.
Great, thanks, Vanessa. Shane, would you like to pose your question?
Yeah, it's kind of on the same vein, but I know just at least for us med students, COVID has kind of thrown a wrench into all of our plans, and I'm sure for everyone else too. I'm very curious for how the residents have you maintained your wellness, at least during the past year, having to maintain your resident duties and training on top of being in the middle of the pandemic.
That's sorry, I can start. That's a really good question, Shane. I think, again, I feel really lucky to be in this residency. I can't stress that enough. Just because, I think the Kaiser system, the system matters so much for these like outside stressors that randomly happen. And I think our system is set up for us residents to basically continue most of our training uninterrupted, which is really nice. And the things that are interrupted, we're able to do telephone and video visits pretty seamlessly. That happened early on and has been really integrated into our practice, which is great because I think some of this telehealth is gonna probably be permanent. And so getting training in that is gonna be probably very important to our future practices anyway. So I'm seeing a lot of people in person still. I think most of our rotations are just as they were before. And then a lot of the outpatient clinic rotations that we had have transitioned a little bit more towards telehealth, but I'm still right now seeing people in the office. And it's especially the people that need to be seen in the office, so more sick visits. And again, the system tends to filter those patients for us really well, which is sort of ideal for what I want to get out of residency and learning the med aspect of it. And then in terms of like wellness, I don't know, it's Northern California, it's like nice weather. I can go outside right now and it's like 50 degrees, almost 60 degrees, and go for a run. So in terms of like me staying active, which is really important for my personal wellness, I'm able to do that really easily with no problems.
Vanessa, did you want to answer that too, or shall we move to the next one?
I think we can move to the next one.
Okay.
I don't think I have much to add to what Billy said.
Okay, I'll ask Susan Wang to ask her question. This is one that Billy and Vanessa may be able to answer, maybe one that Dr. Holder can help with as well, because she does a lot of the schedule shuffle when for leaves. Susan, do you want to ask your question?
Yeah, it's kind of a follow-up based off of some of the stories that Dr. Collin, you're talking about with the residents, and then just wondering for folks who have had to leave for whatever reason, like emergency or otherwise, how long are they able to do so, and then what does it look like when they come back in terms of scheduling and graduation and all of that logistically?
So, like I said, I didn't have anybody that was like that left for sickness, but we had people that got pregnant during residency and they took their maternity leave. we've always been able to rearrange the schedules so the rotations are covered. And I remember Chloe when she had her baby. She came back and then she had the rotations that she had to finish like on her schedule, so she stayed a little longer after graduation to finish all the requirements. But I like, to me it was seamless. We had everything arranged by the time she took a maternity leave. Like everything was continued. There was no like emergency or crisis in the program just because one of our residents had to take time off.
I can make a comment on that as well. We have another resident who is due in January with her second child, and I think the residency program has really embraced it. We are family medicine, and so we are joyful about her second child, and I'm really, really proud of how her peers have handled this. I mean, her peers have definitely stepped up and said, you know what? Please enjoy your time off as a mom. Please take as much time as you need, and they are happy to cover her. And Ted might want to speak to this point with regards to, so there is certain requirements by the American Board of Family Physicians in terms of how much time a resident can be away from a program before it affects the graduation date. But those are pretty easy to overcome. I don't want to, I don't think I'd be sharing too much to say that this resident who is due in January has chosen to take a little more extra time off to be with her newborn. And we are happy and willing to accommodate that and ensure that her education is taken care of ultimately when she returns.
Yeah, I don't know that we need to get into the ABFM stuff. They impose some restrictions around, have some requirements around how much you're allowed to be away from your continuity practice, but you can ask for waivers, and there are ways to get around it. And the bottom line is graduation dates can be altered if need be, and the residents have been very accommodating about swapping rotations, and we've got systems in place and have been able to pull those levers to essentially make things work for the residents and ensure, it's our job to ensure that you're going to become board certified. And that's kind of where sometimes some of the regulations come in, where we have to say, like, you need to contact the board just to ensure that you're going to be okay. But, that's our job as advisors. Parina, would you like to ask your question?
Yes, thank you. I was wondering, it was earlier brought up about the role of efficiency and the way we use our time in residency that can contribute to our overall wellness. So I was curious to know and hear from the residents about their experience with regards to length and frequency of shifts and call and any downtime, as well as didactics.
Yeah, that's a great big question. I think to sort of like sum it up in my experience from today, like I chose to stay late in our gynecology clinic because I was having a ton of fun and working with people that I loved and doing procedures and seeing patients that I really want to be able to do going forward. So I think that experience sums up sort of a lot of the things that this residency offers, which is a lot of flexibility. When I'm up on gynecology clinic, I'm working one-on-one with a bunch of OBGYN attendings, and I can pick their brains about how they practice. And basically, I have the flexibility to go see any patient with any of them at any time, and they love having me in there. And that's just sort of the culture that exists here in almost all of our departments, which makes it really fun to learn. And I love talking about wellness because I think it's a fallacy to think of wellness only as your time off. So much of what you're going to do in residency is at work. And so finding a place that really fits for you, where you're going to love what you're doing and really enjoy it, is going to be important, because that's going to ultimately make you what feels like wellness, I guess. And at least for me, this is a program that that does that. And I think a lot of that is that there's the program was built basically, we never exceed duty hours. That's not really ever a question. Our shifts are humane, to say the least. And I think that we can really maximize our learning and get what we want for our own learning out of each of our rotations. So for me, it's kind of an optimal setup.
I almost feel like you were a plant there, Billy.
That's right. I'm just a robot in a black box that says whatever Dr. O'Connell wants.
You actually said exactly some of the things we talked about in more like that we just put out there at the beginning, about that wellness is about pursuing your passions and enjoying the work you do, and it's not just about your time off or the wellness lunches. And so, well, thank you.
Great. I'm glad I'm just repetitive and not sharing any new information.
No, it's much more impactful for you to say it than it is for me to say it.
Billy's always
at least I think it's true.
And to add on to that too, in terms of thinking about the efficient part of it, so I don't know how many of you are training in situations in hospitals and clinics that may not be as efficient as possible. So I trained in a county system in medical school. So I spent a lot of time chasing down the last echocardiogram from some outside clinic done 4 years ago. So our resident physicians don't have to do that. And so I think that when you talk about efficiency, if the system is set up where the information is at your fingertips, where the resources are easy to find, where the things run more smoothly, you spend more time learning. You spend more time with your education. In residency, you shouldn't be figuring out the nitty-gritty of how the system works from an administrative perspective. That's not your job. Your job is in 3 years to learn a whole lot of information that is going to be the basis of your professional career in the future.
And I think that's one of the beautiful things with the Kaiser system, our integrated system, because I think Ted said about that earlier, like if I have a question for a specialist, I know I can call them and ask. I don't need to necessarily just, I'm going to just send the patient to the specialist. Like if I don't even know if they need a referral, I can call and talk about that. I don't have to be worried about, is my patient going to be able to get that MRI? Is my patient going to be able to see a specialist? Is my patient getting their labs? Because it's everything under the same roof. So like Dr. Stacker said, you can dedicate your time to learn the medicine, to learn, what is the gold standard for treatment for your patients, instead of having to run around, the system and trying to figure out how to get things to happen.
Yeah, thank you, Vanessa. I want to be cognizant of our time with the idea of wellness and getting everybody to their dinner and family and exercise and studies. So maybe we'll just take, I think we can handle these other two questions. There's one from Marianne about night work and one from Brittany about finances. So we'll take those two in that order, and then I think we will wrap and keep us right on time. Marianne, do you want to pose your question?
Yeah, sure. I had a question about night rotations. So I was just curious if your program clusters them together, or do you do that 3 days on, 1 day off, 3 days, like the complete opposite? So I guess this is a question for the residents.
I can tell you, we don't have so many nights that is undoable. Like I think everything was always very doable for me. We have nights when we are on the pediatric wards, but then it's done that you do nights only for 2 weeks, and that's it. It's like you're not switching. And then when you do have that switch is on OB, labor and delivery, but then that's on your second year residency. And for that month, you do have some days of clinic intertwined with some days of nights, but it's done in a way that, like for those 2 weeks you're doing nights. Well, it has changed a little bit because the schedule has changed the way it was when I was on that rotation. But you do nights I did nights Tuesday, Wednesday, Thursday, and yes, then I had Friday off, then Saturday I worked during the day, Monday I worked during the day in the labor and delivery, then I had Monday off just to go into the switch again to do the nights. And it was completely doable. It, you know, I never felt like, oh my gosh, I'm so sleep deprived that I don't know what I'm doing. That never happened, which is great too. So I like the way that like the night calls were placed together. And then when you were when you're in the inpatient award, we have the cross coverage. So what happens when you are senior, like you're always going to have 2 seniors and 2 interns in the team. The seniors switch every week between day team, where you're working with the interns on the day, and the swing shift, which is 12 to midnight. You know, but then we also have a day off in between the shifts so that, you know, you can switch kind of seamlessly, and has worked really well for me. What do you think, Billy?
Yeah, sorry. Yeah, I think to sum it up, we have 6 weeks of nights total in residency, and they are all in 2-week blocks. So there's only 3 blocks of it. And I think part of your question is like, what does our inpatient medicine schedule look like? Are we doing, you know, Q3 call? And we don't do anything like that. It's 6 days a week, all during the day. And then the seniors, as Vanessa was mentioning, kind of switch off in terms of how they cross cover, but it's never like directly overnight. It's just sort of staggered. So overall, a very, again, humane schedule, I think.
Okay, thank you both.
Brittany, would you like to ask your question before we wrap?
Sure. I know we don't have that much time, so can try to keep it short. But I think the Bay Area is a notoriously expensive place to live. So can you guys speak to how the program supports residents financially in terms of retirement benefits, financial advising, that sort of part of life?
Billy, Vanessa, you want to talk about
Yeah, sure. Yeah, it is very expensive. It was shocking even for me coming from Philadelphia. It was like twice as expensive to live here. I think our salaries my salary to me at least feels more than adequate to cover my living expenses and have some left over. And we get a housing stipend every year. I forget how much it is exactly, but it covers like a month or 2 of rent for me at least. Yeah, and we also get meals at the hospital, and we get $60 a month for a gym membership outside of it. So that covers some of those outside expenses too. But it feels more than livable for me, I think.
I would agree with Billy. I moved here from Georgia, and it was like, oh, how much for an apartment? Really? Like more than my mortgage? Okay. But then, sincerely, I agree that I think my salary is more than enough to cover my expenses. We have those stipends. We have, there's also a fund for you every year to use for if you need to buy a new stethoscope, or if you want to take a course, like, you know, that's it's money that is put aside that you can use for that. And yeah, like the meals in the cafeteria help a lot. I haven't had any problems, and we had some this year on our clinical skills month. We had a meeting with a financial advisor to discuss things like loan repayments and things like that. So yeah, I haven't had any problems. I had the shock of like, oh my gosh, living in the West Coast is expensive. But, you know, I think I'm more than fairly compensated and being able to deal with this without much of a problem.
Thank you. I'm also from Georgia, so I might have to email you about the shock.
And just to fill in a few other things, you know, parking is free at our medical center, so you don't have those kind of hidden expenses that sometimes can hit you. Retirement plans are not necessarily built into a resident benefit pack. The benefits are they're on our website. They're actually quite thorough. Retirement's not part of it, but if you listen to the financial advisor, you absolutely can set up a Roth IRA and start working on your retirement nest egg. And if you become a Kaiser Permanente physician after residency, you actually do get some credit towards retirement for having been a resident, and it's actually pretty generous. So there's some things that you don't even necessarily know about on the front end, but yeah, I think the residents did a very good job of giving us their input. Oh, we got Billy on video now.
Go ahead. One important thing financially that for me was like amazing is when I started my residency at Kaiser, is that my health benefits for me and my partner are covered and is not taken out of my paycheck, which doesn't happen everywhere. My other friends, they're doing residency somewhere else I've been in touch with, they all pay for their health benefits. And, we have the Kaiser plan covered, which is really, really amazing.
Thank you.
Billy, were you going to add something?
Nope, just stopped. So I figured I'd turn on my video so people could actually see who I am.
Awesome.
You're not a robot.
I hope it doesn't disencourage you guys.
So Tessa, Kathy, would you like to wrap us up?
Sure. I just want to say thank you to all of you, and it gives us great pleasure to see how many wonderful people are choosing family medicine, and we know that our profession is in good hands. You are the next generation, and it's just great to see you all. Thank you for joining us. Tessa?
Yes, thank you so much for taking times out of your evenings to discuss all things wellness with us. I know I feel more well just after this discussion, and I worked from home today, so I snuck in a walk around 4 o'clock when it was still sunny outside, which is always really lovely. And a special hello to our community health virtual sub-Is joining us today. I see all of you. But thank you all so much. If you have any questions, reach out to us anytime, and have a wonderful and safe holiday season.
Thank you so much.
Bye, everybody.
Bye, everybody.
Thank you.